Adverse childhood experiences include things like physical, emotional, and psychological abuse, physical and emotional neglect, and household dysfunction, including things like homelessness or not having enough food. ACEs were first described almost 25 years ago in a study conducted by the Centers for Disease Control and Prevention and Kaiser Permanente. What they found is, first of all, ACEs are extremely common. 50% of the population has experienced at least one ACE. Second of all, they found that the more ACEs someone experienced, the more likely they were to have poor health later in life. For example, people who experience 4 or more ACEs are 4 times as likely to have depression or alcoholism and twice as likely to have heart disease. When ACEs were first described, they focused on experiences that happened inside the household. However, over time, researchers have identified that things that happen outside the household, including in your community and your neighborhood, can also have an impact on later life health. These have been called expanded ACEs. Expanded ACEs include things like witnessing violence, being bullied, living in an unsafe neighborhood, or experiencing discrimination. Whenever a child experiences stressful life events or thinks that they're in danger, the body kicks into what is known as fight or flight mode. This increases stress hormones in the body designed to get the child away from the threat and back to safety. If a child continues to experience stressful life events, they will remain in fight or flight and never recover. The body becomes conditioned to this high stress state and overproduces stress hormones. Having too high of stress hormones over time affects our developing brains and bodies and makes us vulnerable to being physically and mentally ill over time. Simply because you have experienced ACEs does not mean that you're going to grow up to be unhealthy. There are many things that you can do that science has shown to buffer against stress, change your biology, and keep you healthy. These include getting regular exercise, eating a healthy diet, having warm and loving relationships, meditation, spending time in nature, and getting good sleep, to name a few. Sometimes you may need to get professional help. Your doctor or other provider can refer you to services such as counseling, family therapy, or a drug or alcohol treatment center. The bottom line is that while ACEs do affect us, we can change how much they impact us by taking the best possible care we can of both our physical and mental health and well-being.